Welcome to Good2BeBack's Complete Health Pass. In this video, you will learn how to check in. To check in means to answer questions related to your current health status. If you see a check-in button, that means the organization which you have linked to requires you to answer questions regarding symptoms, exposures or close contact, and/or other health-related risks. To check in, simply click on the check-in button. You will come to the check-in page where you can look at your previous check-in history, or you can click on check-in to continue. Every organization decides which questions they are going to ask. They can change these questions at any time. So it's important for you to read the questions every time you check in, as they may have changed since the last time you checked in. This is an example of a question that asks if you have tested positive for COVID-19 in the last 24 hours. It may say in the last day, the last 5 days, 10 days, 14 days. It could say anything. So please read the questions carefully. If you say no to this question, and you hit the green button to continue, you will come to the next question. The next question in this case, in this example, is a symptom-related question. And because mobile screens can be very small, we limit the number of symptoms you can list on a page. The organization that you have linked to can change this list at any time. So please read the list every time you check in. Let's say in this case, you had one of these symptoms. So we'll say yes, click on the green button. And then the next question is a subsequent or qualifying question so that the organization can better understand the health risks you're facing and/or when you have faced them. So let's say it was yesterday. And let's say you didn't have any of these symptoms. And the next question in this scenario is an exposure or close contact type question. This can be asked in many different ways. So you must read the question every time you check in. This one says within the last 24 hours. And again, it could say last day, last 5 days, last week, last 10 days. You have to read the question every time you check in. If you answered yes to this question, you'll get the date exposed question. You can put any date in there that applies to your situation. Please note when you put the dates in, it may affect your quarantine date. So be very careful when you answer a date question so that your quarantine dates are accurate. Another subsequent question in this case would be, at the time of exposure or close contact, was everyone masked? This is a question to determine the risk of exposure to everybody that was in the same place as you at the time. So if you say yes, that means it's a good thing. Everyone was masked. Let's say yes. And the last one is where you were exposed. So if you were exposed on site, which could mean school, work, event, could say anything here. So read it carefully. Or it could say in the community. If it's in the community, that's quite different than on site at work or school. So if you have any questions about that, ask your employer, school, or the event. In this case, I'm going to click on in the community. Every time you submit information on your health status, you must confirm that you are, to the best of your ability, telling the truth. So if that is the case, please click confirm. Click OK. In this case, it's going to show that you had a bad daily check-in, meaning that you had some health issues or risks, and your badge will be set to deny. In some cases, it may be set to pause, but again, it depends on the organization you're linked to and what their policies are. We hope that this video helped you better understand that check-in is a questionnaire that is designed by your employer, school, or an event that you are attending, and it's very important that you read every question carefully because they can change at any time. Thank you for watching.